We've talked a lot about postoperatively and preparing that patient to return to work. What about preoperatively? Kind of the mindset of the physician talking to the patient. Obviously, you're going over the risks of the procedure and the outcomes and what you hope for in terms of improving functionality and decreased pain. But any discussions with the patient beforehand about expectations of return to work also?
Yeah, no, absolutely. I think that's part of decision making is somebody needs to know what is, coming up in the future for them and what just to be able to plan their life and plan their job and to be able to tell their employer like what they're going to be going through. So I do have a sheet here of commonly asked questions that I always sit down and fill out with somebody, and it goes through when can someone drive, how long in a sling, how long on crutches, and then how long out of work. And I think that sets the table for 6 weeks from surgery, you're going to be back at work, doing something, just showing up, light duty, say. At 3 months, you're going to be advancing. And then at, say, 4 to 5 months, you're going to be full duty. And that's the expectation. And I think if someone has that in their head, and if an employer has that, then, everybody can plan accordingly. I think more information is better, especially preoperatively when you're, so there are no surprises after surgery.
And I think it's helpful. Again, I keep talking about that mental health component, but it's very real. And I think that for patients to, again, have hope, and it takes away some of that ambiguity of, am I ever going to go back to work? And what if I don't? But rather setting the table and setting the tone, as you mentioned, that this is the expectation and we will get you there.